Hey everyone, welcome back to MCQtestPrep. Test your knowledge with 15 new PTCB Pharmacy Law practice questions for the 2026 exam. Stay till the end, challenge yourself, and see how many you can answer correctly. Question number 1. Pharmacy Law Alert. Don't miss this question. A pharmacy technician receives a prescription that is missing the prescriber's signature where one is legally required. What should the technician do? A. Contact the pharmacist before the prescription is processed. B. Dispense the medication and obtain the signature later. C. Sign the prescription on behalf of the prescriber. D. File the prescription without filling it. Answer: A. A prescription requiring a prescriber's signature is not legally complete without it. The technician should immediately notify the pharmacist so the issue can be resolved before any medication is dispensed. Question number 2. Future pharmacy techs, stay focused. A patient asks a pharmacy technician whether a newly prescribed medication can be taken with an herbal supplement. What is the technician's appropriate response? A. Recommend stopping the herbal supplement immediately. B. Refer the patient to the pharmacist for counseling. C. Advise taking the medication 2 hours apart from the supplement. D. Search online and provide an answer. Answer: B. Providing clinical advice is outside the technician's scope of practice. Question numbers involving drug interactions or therapy must always be referred to the pharmacist. Question number 3. This law question is commonly tested on the PTCB exam. A technician discovers that a controlled substance inventory count does not match the perpetual inventory record. What should be done first? A. Adjust the inventory record to match the count. B. Ignore the discrepancy until the next inventory. C. Report the discrepancy to the pharmacist immediately. D. Order replacement stock. Answer: C. Controlled substance discrepancies must be reported promptly. The pharmacist will investigate the cause and determine whether additional documentation or reporting is required. Question number 4. Let's test your pharmacy law knowledge. A customer requests prescription information about another family member without authorization. What should the technician do? A. Provide only the medication name. B. Share the refill status only. C. Give the information if they have the same last name. D. Protect patient confidentiality and decline the request unless disclosure is authorized. Answer: D. Patient prescription information is protected by privacy laws. Unless the patient has authorized disclosure or another legal exception applies, the information must remain confidential. Question number 5. This is a must-know legal concept. A pharmacy receives a prescription that appears altered after it was written. What is the technician's best course of action? A. Process it as written. B. Notify the pharmacist before filling the prescription. C. Rewrite the prescription neatly. D. Ask the patient which version is correct. Answer: B. Altered prescriptions may indicate an error or possible fraud. The pharmacist should evaluate the prescription and verify its validity before dispensing any medication. Question number 6. Read carefully, every word matters here. A pharmacy technician accidentally accesses the wrong patient's profile, but closes it immediately without sharing any information. What should the technician do next? A. Continue working without reporting it. B. Delete the patient's profile. C. Print the profile for documentation. D. Follow the pharmacy's privacy policy by reporting the incident if required. Answer: D. Even unintentional access to protected health information should be handled according to the pharmacy's privacy procedures. Prompt reporting helps maintain compliance and accountability. Question number 7. Many students miss this question, will you? Who is legally responsible for the final verification of a prescription before it is dispensed to a patient? A. Pharmacy technician. B. Pharmacy cashier. C. Supervising pharmacist. D. Delivery driver. Answer C. The pharmacist is legally responsible for performing the final check of the prescription. Technicians assist with preparation, but cannot perform the final verification. Question number 8. Think like a certified pharmacy technician. A technician notices that a medication label was printed for the wrong patient before the prescription leaves the pharmacy. What should happen first? A. Remove the incorrect label and notify the pharmacist. B. Cover the label with a blank sticker. C. Dispense the medication after changing the patient name by hand. D. Ignore the error because it was caught early. Answer A. Mislabeling is a serious medication safety issue. The incorrect label should never be used, and the pharmacist should be informed so the prescription can be corrected safely. Question number 9. Can you choose the legally correct answer? A pharmacy technician receives a request from law enforcement for prescription records. What is the technician's appropriate action? A. Release the records immediately. B. Direct the request to the pharmacist according to legal procedures. C. Refuse to speak with law enforcement. D. Provide only verbal information. Answer B. Requests for patient records must follow applicable legal requirements and pharmacy policies. The pharmacist should review and manage these requests to ensure compliance. Question number 10. Pharmacy law is all about patient safety. A technician is asked to counsel a patient on how to use a newly prescribed inhaler because the pharmacist is busy. What should the technician do? A. Demonstrate the inhaler technique. B. Read the package insert to the patient. C. Refer the patient to the pharmacist for counseling. D. Ask another patient to explain how it works. Answer C. Patient counseling is the responsibility of the pharmacist. Technicians should never provide clinical counseling or instructions regarding medication use. Question number 11. Stay alert. This one can be tricky. A pharmacy technician is asked by a prescriber to change the prescribed dosage on a prescription after it has been received. What should the technician do? A. Change the dosage as instructed by the prescriber. B. Ask the pharmacist to handle the modification according to pharmacy policy. C. Tell the patient to contact the prescriber. D. Cancel the prescription immediately. Answer B. Changes to a prescription that affect drug therapy should be managed by the pharmacist. The technician should not independently modify prescription information that requires professional judgment. Question number 12. Here's another important PTCB law question. A technician accidentally leaves a computer terminal open with a patient's profile displayed. What is the best immediate action? A. Log out or lock the workstation immediately. B. Turn the monitor toward the wall. C. Print the patient's profile. D. Ignore it if no customer is nearby. Answer A. Patient information must always be protected from unauthorized viewing. Locking or logging out of the workstation helps maintain confidentiality and complies with privacy regulations. Question number 13. This topic could appear on your exam. Which task may generally be performed by a pharmacy technician under appropriate pharmacist supervision? A. Selecting a new therapy for a patient. B. Counseling a patient on side effects. C. Preparing a prescription for pharmacist verification. D. Authorizing prescription transfers. Answer C. Technicians may assist with prescription preparation, labeling, and data entry. The pharmacist remains responsible for clinical decisions and the final verification before dispensing. Question number 14. You're almost there. Let's tackle another challenge. A patient requests a copy of their own prescription record. What is the technician's best response? A. Refuse the request completely. B. Direct the request through the pharmacy's established procedure with pharmacist involvement if required. C. Ask another customer to verify the patient's identity. D. Provide another patient's record for comparison. Answer B. Patients generally have the right to access their own records, but pharmacies must follow established procedures to verify identity and protect confidential information. Question number 15. One more pharmacy law question. Let's finish strong. A technician notices that a prescription has expired under applicable law before it is presented for filling. What should happen? A. Fill the prescription one final time. B. Change the written date on the prescription. C. Process only half the quantity. D. Inform the pharmacist that a new valid prescription is required. Answer D. Expired prescriptions cannot legally be filled. The pharmacist should notify the patient or prescriber that a new valid prescription is necessary before dispensing.